Sure. Good morning, good afternoon, good evening, wherever you are, and welcome to the second module on geo-enabling the health information system. This series is hosted by the UNICEF East Asia Pacific Regional Office and Moru Tropical Health Network with support from TechNet 21. And we'd be happy to know who's with us today, so you can already introduce yourselves in the chat box and tell us your name and where you're from. You can also use the chat box if you need any technical support. So I'll do my best to help you in case you have trouble with sound or anything. If you have any question during the presentation, please use the Q&A box. It's available at the bottom of your Zoom window. You can ask your questions at any time and they will be answered after the presentation or during the presentation, depending on the best moment decided by the presenter. Finally, this session is recorded. We'll share with you the links to the videos as well as the slides by email. I hope you'll enjoy this session now, and I'll give the floor to Ridwan. Ridwan, the floor is yours. Thank you.
Thanks, Alex. Again, welcome everybody to our second module of this six series of training on geo-enabling health information systems. As you might aware, this is a 2-hour sessions. And before that, maybe I'll introduce myself. My name is Ridwan Gustiana. I'm a regional health specialist in UNICEF EAPRO, looking after various programs, including digital health as well. So before we start, where Steve will mostly lead the session, maybe I'll go over on how many people was registering. We have around 500 registration. Well, I'm happy that this has been response positively. Half of them, of course, from our from Asia Pacific region, and we have also very around 20% representative from the Ministry of Health, and of course we also have some colleagues from our UNICEF as well, around 30%. Of course, with live webinar, we also see there are some obstacles for people attending on live, but as I mentioned, as also everyone knows that we also posted this in TechNet, and then colleagues who already registered can view the recording and learn the modules via recording. Last time on the first module, we have around 120 participants following it lively. Before we move to the content of the trainings, maybe let me review again on the overall workshop objective. The workshop objective is to disseminate operational guidance material that can assist countries in implementing the geo-enable process of health programs in general, and the development and implementation of micro plans in particular, to demonstrate of geospatial data and technology in public health, introduce the health information system geo-enabling framework and its implementation in countries. And last one is to transfer knowledge, expertise, and resources that will allow participants to implement the health information system geo-enabling framework in their respective country. So we hopefully by the end of this workshop that participants will have a better understanding on what geospatial data and technology can bring to public health programs, and how to geo-enable the health information system in sustainable way to benefit from this type of data technology. Again, we also remind that this is not GIS training, but it's more broadly on geo-enabling health information systems. So that's for me. To save the time, I hand it over to Steve for leading us with the content of this second module. Thank you very much, Steve. Over to you. Thank you.
Thank you, Ridwan, and welcome everybody once again for the second module. So a few slides before we move to today's agenda. The first one to remind you or inform those that are joining for the first time that all the training workshop material, not only the slides, including today's slides, but also all the documents we are referring to during this training workshop are accessible from the Google Drive folder, for which you have a QR code and a URL here. And Izzy is going to put the URL in the chat as well. So the slides for the first and the second modules are already in there. And each time you see the Google Drive logo, this one here, appearing next to a document in the slide, it means that you will find that document also in there. It has been mentioned that each module will be recorded, is recorded, and will be available. What you have also here is the link to the glossary of terms that we are using in the context of this training workshop. So if there is any specific term that is unclear to you during the sessions, you can have a look at this link and you should get your answer. If not, you have the Q&A, so don't hesitate to use it. Talking about this, it was mentioned, I mean, for those who have never seen the Q&A window in Zoom, this is how it looked like. You can post your question there. We'll try to answer those questions as much as possible during each module. If you feel more comfortable to ask the question in private, you can also use the Google form that you have here. You will have also the link in the chat. And we'll ask questions. You can ask questions anytime, including between modules, and we'll also answer those questions. We had one during the first module, which I answered by email afterwards, so don't hesitate to use it. And then the chat, indeed, I mean, you guys are already introducing yourself there, but you can also use that to share any resource or experience you see relevant to the participants during the module, right? So if you have anything you would like to share, don't hesitate to do that. Please include your name, country, also the link if you have any documents or any particular material you wanted to point to, a website, for example, don't hesitate to add it there. I want to also remind now about the HIS Geo-enablement level assessment questionnaire for Asia Pacific, right? This is an exercise for which we'll show some results today, but more in more detail during the third module. So this is really addressed to participants from Ministry of Health program or units of Asia Pacific. It's a short questionnaire, 13 questions, and in addition to providing very insightful information, as you will see today, this is also what we're going to be using as the starting point to select up to 3 countries in Asia Pacific who will be receiving support to develop an action plan aiming at filling the gaps identified during the assessment. So please, if you are from the Ministry of Health and you have not completed the questionnaire, please do so. If you are stakeholders, partners working with the Ministry of Health, please encourage your counterpart in the ministry to complete the questionnaire. The deadline now, our deadline this time is going to be July 12th, so we have enough time to analyze the result to be able to present that during the third module. For information as well, here is where we stand as of today regarding the questionnaires that have been completed by countries from Asia Pacific. Around 13 countries, right, for which we have at least one program or unit within the MOH who has completed the questionnaire. The countries which are at the top here are those currently having the highest probability to be selected for the support mentioned earlier, in case they would like to do so. But of course, there is still 1.5 weeks remaining to potentially change this list here. So please don't hesitate to do this. Quick recap of the first module. We first looked at the geographic dimension of public health and also at how geospatial data and technologies can contribute to addressing public health challenges. So that was the first session during this module. We then went through a set of examples, so real projects that have been implemented in countries using geospatial data and technologies to help address specific challenges across different use cases like planning, communicable vector-borne disease, immunization, and emergency management. And we ended the module by introducing the HIS geo-enabling framework. Here is the link for those, again, that could not attend this first module to have access to the recording, as well as the slides, in case you want to have a look even during the talk today. So let's now move to the second module of the training workshop. And here is today's agenda. So 3 sessions today. What we will be looking at is how the HIS geo-enabling framework is being implemented in countries. And then we will start looking at the first step in the implementation process. The first 2 steps, actually, first one being to look at what are the priorities and the challenges that programs or intervention are facing, and how, if and how, geospatial data and technologies can help addressing them. And we will do that through this first set of results from the assessment. And then the second step, which consists at understanding the geography of the program or the intervention that is being geo-enabled. As it was mentioned earlier by Ridwan, the duration of this module is approximately of 2 hours, including the Q&A. We'll take at some point the Q&A. We'll also have a 10-minute break after session 4. So let me dive into session 4, which is looking at how the HIS geo-enabling framework is being implemented in countries. So the process that we have been using is described in detail in the HIS geo-enabling toolkit, which we introduced during the first module. And this process has for objectives to really help countries go through a detailed described process to identify basically where the country finds itself across the 9 elements of the HIS geo-enabling framework, and then go through additional steps that lead to the development of an action plan aiming at addressing those gaps. So this process is quite simple, 6 steps. And the last one is actually closing the loop, as you will see, so that there is really a continuity into not only the assessment, but also, of course, the filling of the gap or the scaling up of the activities that are being implemented at each round of this process. Here is a visual representation. So everything I'm going to show you now are actually coming from the HIS geo-enabling toolkit. So you will find that there, including this visual representation of this implementation process, which also include the indication of the step at which you can consider the health information system as being geo-enabled, which is really once you have basically filled any gaps that could be identified during the assessment phase. Now, this is the process when you are really looking at geo-enabling the health information system as a cross-sectoral resource, right, for the whole health sector. If you are looking at geo-enabling a specific program or specific intervention, the process is a bit longer and include 2 more steps at its beginning. The first step, step A here, A, is to identify the intervention or program specific actual priorities, challenges, needs, or gaps. This is the step that will allow to identify if geospatial data or technologies can actually be used to address some of these challenges, priorities, needs, or gaps. The second step, step B, is then used to understand the geography of the program or the intervention, to define also the GIS-based products that will be used to support the program or intervention, as well as the needs in terms of equipment and technical capacity to generate these products. The rest of the process is then exactly the same as the one you have when you look at the health information system. What this means really is that the long-term sustainability of the geo-enablement of a specific program or intervention needs to pass ideally through the geo-enablement of the health information system. And as you will see in the coming sessions and modules, this is because the foundational elements of the framework, for those who remember the pyramid, right? The base of the pyramid is composed of elements that are actually common to any program or intervention, right? So this is not something that is being developed separately for each program, but really something where we are trying to have a convergence of efforts and resources to develop a common geography that can support all the programs and intervention for the health sector in countries. So let's have a look at each step of this process. So this is the one we will be using as reference during the present training workshop, right? Because we are looking not only at geo-enabling the health information system, but actually also any program or intervention. So the first step, right, in this process really consists in once again identifying actual priorities, challenge, needs, and gaps of the concerned program or intervention. This is not a step that is meant to take much time from the moment it is led from within the country, right? And all the concerned programs and or interventions are on board of the exercise in addition to the entity, the unit in charge of the health information system. So if that can be facilitated in countries, have everybody on board, this is done as part of a workshop, for example, and some preliminary work. This is the reason why there is a set of supporting tools which are mentioned in the HIS Geo-enabling toolkit, including the HIS Geo-enabling assessment questionnaire that some of you have completed for the present training workshop. And the first two questions in these questionnaires have been designed on purpose to capture the list of current priorities as well as challenges of each program or intervention or the HIS unit. And we will look at analyzing the analysis of the answer received so far in the next session. There are additional resources which have been that are also included in the toolkit, which is available thanks to a recent reference document. These documents are all included in the Google Drive folder for the present workshop, and really form basically the foundation. I mean, the HIS Geo-enabling toolkit and these three documents are really those four documents are the foundation for helping the implementation of the process in countries. So this is the first step. Once it has been identified that geospatial data and or technologies can help addressing some or all of these priorities, challenges, needs, or gaps, then the next step consists in, again, identifying and understanding the geography of the program or intervention, which we will do during section 6 today. So the last session of the present module. The second step, look at defining these GIS-based products to support program or intervention. This is going to be the topic of module 3. and also finally to identify and document the equipment and technical capacity or technical expertise that is needed to generate these products. Again, also, this is not a step that is meant to take a lot of time. Again, if the process can be led from within the country, facilitated by local partners, and the concerned parties are available and can be involved, again, in the context of a meeting or a workshop. That can actually, step A and B can be part of the same workshop to reach the stage where there is a clear understanding of how, if and how geospatial data and technologies can help support or address program or priority challenges and needs. There are also a set of tools available for supporting this step, again, coming from the same set of reference documents. So now that we have these products defined and the need in terms of equipment and technical capacity also identified, we can start the basically what constitute the first step of the HIS geo-enabling process. So we are plugging now to the more cross-cutting kind of elements of the framework. And this first step consists in assessing the current level of geo-enablement of the health information system and identify gaps across the known elements of the framework. Again, if there is no gaps being identified, then the HIS itself is considered as geo-enabled, and the process can then focus on purely developing an action plan and generating the product, that will be supporting the programs and or interventions that needs to be geo-enabled. As part of this assessment, once again, you can see same entities being involved. The more program you can have on board, the more kind of detailed and also complete is the picture of the current situation across the 9 elements of the HIS geo-enabling framework, and therefore more efficient will the action plan be in trying to address those basically gaps that are identified. Also, when it is just a note here, when the process is implemented in the context of a program or an intervention, this is also where we use these steps to assess the availability, quality, and accessibility of the data that are needed to generate the products that have been defined during step B. Right, so this is at the end of this, you should really have a complete gaps across the 9 elements of the framework, as well as in terms of the data that are needed to generate these different products. Once this is done, step 2 of the HIS enabling process, which basically look at defining strategies to address the gaps that have been identified during the assessment. So we have developed a non-exhaustive list of possible strategies together with recommendation in terms of stakeholders to be involved, as well as the level at which these strategies could be implemented. So this has been defined based on the implementation in different countries, and this is accessible from the HIS geo-enabling toolkit. You can, so basically it starts, it's a table, it's one of the annex 5. You have different scenarios with different type of gaps being described, and for each of these gaps, we have proposed strategies to be able to address them. And these strategies represent the first piece to very key information to develop the action plan, which is aimed at filling the gaps that have been identified. So we'll come back to this during the 6th module, during session 20, and how you basically come up with those strategies as part of the action plan development. Step 3 in the process consists in developing the action plan itself. This is a step which is anticipated to take more time than the precedent ones, as of course there is several activities and certainly a lot of consultation that needs to take place in order to define, agree upon, and even budget the activities for each of the HS framework elements that present gaps, right? So this is also the step for which the most detailed set of tools have been developed and are mostly accessible from the HIS Geo-enabling toolkit. By experience, it's really recommended to develop action plan for which the implementation period does not extend beyond 1 year, right? This allows to really assess, document, and sustain what is being established on a regular basis as part of step 5, and also allows to consider new development, right? There might be new policies, new entities, change in the basically the organigram of the Ministry of Health. So it allows to take that into account. And there are also some mechanisms which might have been established during these 12 months, including the establishment of the national spatial data infrastructure, for example, in some countries. So it's important to take that into account. In addition to that, I mean, if the gaps are very significant and will require for more than 12 months of implementation, then this could be addressed as part of the next iteration of the geo-enablement process. So you could very much, I mean, having defined, identify all your gaps and decide that for this first iteration, you're going to be focusing on these particular elements, also because of the availability of funding, right? And then the rest will be coming at a later stage as part of a second or third plan. As you will see, the volume of time and resources needed to implement the process until now is limited, but we'll cover this in more detail during session 21 in module 6. So that module 6 is really when we're going to be focusing on the development of the action plan. Okay. From the moment you reach the implementation of the action plan, of course, that's where you have the longer period in the overall process. Again, 9 to 12 months. Generally, that's what we have been using. Of course, the duration and volume of resources that are needed for this will depend on the number and I will say size of the activities that have been included in the action plan. There is no specific tools included in the toolkit in relation to this step, and this simply because this can vary significantly, of course, from one country to another, and also depend on the applications of geospatial data and technologies that are useful to the concerned program or intervention. So again, we look at that in module 6, in session 22, a little bit more in detail. What's important once the action plan has been implemented is, of course, like any other project, to assess, document, showcase also, and sustain the result of such an implementation. All these activities are important to ensure that what has been established during the implementation of the action plan can continue beyond such implementation. So this is part of the long-term sustainability of the geo-enablement. Again, something we'll talk about in module 6. There's a few tools which are included in the toolkit, including examples of what we call story maps, which is an interactive way of basically sharing the result of geo-enabled implementation or program or intervention, which is quite interesting to look at. The last step in the process, as I was mentioning earlier, is to close the loop, basically, is to restart this process on a regular basis. And this independently from the level at which the geo-enablement is taking place, right? If you are looking at geo-enabling the health information system, so the cross-cutting kind of implementation versus the implementation at the level of a program or an intervention. But once again, the two are connected, right? And therefore, this restart from a programmatic perspective include also to look at where you stand in terms of the geo-enablement of the health information itself. So this step is also documented in the toolkit to ensure that the process is basically, of course, taken into account. That's why it has a symbolic duration of 1 day, right? It's just the action of starting the process. And of course, it's also a party to take into account the fact that several elements might have changed between each iteration, even the strategy or the public health priorities might have changed. It might be a change of government, etc. Will be taken into account when restarting this process. Okay, this is what I wanted to cover with this first session. I don't see any particular questions in the Q&A. Do we have anything in the chat to look at?
Nothing at the moment.
Okay. So I proposed that I continue. We can do the break a little bit later when we'll reach the maybe the middle of the session. So break for later. Let's go to session 5 of this training workshop. And what we will do here is to look at the answers received for the first 2 questions of the HIS Geo-enablement level assessment questionnaire, questions that are looking at the current priorities and challenges of the different programs who have completed the questionnaire. So once again, this is the first step of, it's part of the first step of the process, aiming at geo-enabling program or an intervention, right? So top of step A in your whole process. And this is a questionnaire which is actually included in Annex 2 of the HIS Geo-enabling toolkit, for which you had the URL earlier. The objective of this short questionnaire, there's only 13 questions, it's maximum 15 minutes, is really to obtain a high-level picture of the current situation across MOH programs and units when it comes to their level of geo-enablement. As mentioned earlier, the first 2 questions are related to this first step in the process, and they are looking at what are the current programs or unit priorities, and also the challenges that are currently faced by these programs or units. The answer to this question can be used to identify if geospatial data and technologies can be used to address some or all of them. And these answers also serve as a baseline for developing the action plan to fill the identified gap. And also this baseline also allows to monitor how the situation in terms of the geo-enablement evolves through time as you go through different iteration of the implementation of the process. Ideally, this questionnaire is implemented across as many programs, units, department as possible within the Ministry of Health, malaria, TB, HIV elimination programs, immunization, maternal and newborn health, etc., HIS, HMIS unit. Again, the more entities, MOH entities you have participating to this assessment, the more complete is the picture. And at the same time, what's interesting is that it helps as an introduction on the concept and process for the geo-enablement of the health information system. It helps to clarify the terminology that is being used. And very often it helps also program to share information, share knowledge among themselves, and sometimes to clarify also certain things. I mean, you will see in the next module that there is really, for some countries, difference in understanding of where the ministry finds itself in relation to certain elements from the framework, like governance, or things like the general vision, plan, and strategy for the management and use of geospatial data and technologies. So let's look at the result, but before that, some statistics to have an idea of the respondents' profile. At this stage, we have 36 respondents, so we had 36 individuals who responded to completed the questionnaire, each of them representing a specific MOH program or unit based in 14 different countries in Asia Pacific. As I mentioned, we only have taken into account the answer received from countries in Asia Pacific. Those who have completed the exercise, I mean, that's also a way for you to, from outside Asia Pacific, that's a way for you to kind of be familiar and have an idea of what this questionnaire is about, and also how long it takes to be implemented. But they are not taken into account here in this result. We have also, in terms of programs and units, we have respondents from 8 different programs. The ones being the mostly represented are the malaria elimination or control program in countries and the HIS units. And also those, I mean, the name might change from one country to another, right? I put them under a certain classification, but I guess you will recognize yourself. The third one being mostly represented are population and family health. At this stage, of course, because of that, the result I'm going to show you are mainly driven by the priorities and challenges of those 3 programs, malaria elimination in particular. We hope this is going to change by the time of the 3rd module if we manage to get more answers from other programs so that we have a larger set of inputs. So now here is the analysis of the answers received to the first questions in the HIS geo-enablement level questionnaire. So question which was dedicated or is still dedicated to identifying the program units' main priorities, objective targets, or goals that drive the current agenda. What I have done here is to classify, to group the priorities. So we had 108 priorities, 36 times 3 priorities according to the classification you see here. This could have been grouped differently potentially, but I tried to reflect really what was expressed by the respondent. And as you can see here, and as we could anticipate, of course, the priorities that are at the top of the list are related to malaria elimination and control, including surveillance also and response, related to the strengthening of the health information system, and also to maternal and newborn health. What's interesting, of course, is that the top priority, disease elimination and control, together with disease surveillance and response, as well as case detection and management, I would say, relate to the first public health function that we looked at during the first module, right? And the importance of geography when you look at eliminating and controlling a disease like malaria, right? You might remember this schema that comes from the WHO guidelines, which show how basically the geographic granularity and also temporal granularity evolves as you are getting closer to elimination and the need for maintaining the zero case basically situation, right? So very strong geographic dimension in relation to these particular type of set of interventions. The second priority, which is the strengthening of the health information system, which includes, but is not limited to, improving reporting, data quality, and also information system interoperability, right? So this priority, this group, this type of priorities is connected to the digitalization of the health system. And as we saw during the first module, the geo-enablement of the health information system contributes to the digitalization of the health system. And as we will see during the fourth module of the training workshop, it also contributes to data quality and interoperability. So again, it's not a geographic dimension per se, but it's more the role that geography, geospatial data, and technologies can bring to the digitalization and the strengthening of the health information system. And the first first group of priorities, which is to improve access to health services, bring us back to the public health function, right? This was the second public health function that we covered during the first module. And as discussed and also illustrated with real example at the time, there is a strong geographic dimension to accessibility to health services, right? I mean, the geographic, not only the geographic accessibility, but also in relation to the spatial distribution of the target population and the spatial distribution of course, the services, right? So all of that combined, if you might remember, are the first three layers of the Tanahashi framework, which is looking at the effective coverage of the population in relation to basically a particular type of services. So geography is not only present across these three group of priorities that are arriving at the top of the list here, but they are actually present also in the other ones that are listed. And even some of you have clearly mentioned the mapping and even the analysis, the spatial analysis of certain disease as being a priority for your own program or unit. So this was the first question in this HIS geo-enablement level assessment questionnaire. The second one was looking at the main health system challenges faced by these same programs. And as we can see here, we have here the 19 challenges that were listed in the questionnaire have been selected. So all of them, there were 19 in the questionnaire, so all of them have at least been selected 7 times by the respondent. Again, what arrives on top of the list is very much related to the program which have been contributing the most to the questionnaire, right? Delayed reporting of events is related to disease surveillance and monitoring, geographic inaccessibility, accessibility to healthcare, Interestingly, the third one is the lack of quality, reliable data, which relates to the question of data quality. And that really, again, confirms the ranking of priorities that we observe for the first set of questions. You might remember this figure on the right. I also showed during the first module, which is a figure illustrating how application of geospatial data and technologies, right? We look at 5 main applications of geospatial data and technologies can help address these 19 challenges. And of course, at a different degree, depending on the challenge, right? There might be small contribution for some of them. It might be a much bigger contribution in others, like geographic inaccessibility. All of these, lead to the conclusion of this exercise, which is that this kind of data and technology, so geospatial data and technologies, can really help address those priorities and challenges. And also to say that when you reach the end of this assessment and you have to kind of look at if geospatial data and or technologies can help address or resolve some of these priorities, challenges, etc., the answer is most likely going to be yes, right? Because of the fact that there is always a geographic aspect to any specific program or intervention. Okay, we are running fast. We're going to be able to finish earlier. No questions so far. What I just wanted to do to finish this session is to mention 2 additional resources, which are also showing how geospatial, the application, these 5 applications of 5 main applications of geospatial data and technologies can support specific programs. The first one is this table that you find in the Geo-enabling micro-planning handbook, which was released sometime last year, and which put in relation basically and shows how these 5 main applications can support the different generic phase of the micro-planning process. So as you can see, at least 1 and then up to even the 5 applications can support each of the phase of this particular process. The other information and resource in line with this is coming from UNICEF's guidance on the use of geospatial data and technologies in immunization program, where you don't have a table or a visual, but you have these paragraphs that show or indicate how the geospatial data and technologies can help addressing immunization specific needs or gaps. So there is really literature in relation to this. Okay, still no question in the Q&A. I have not seen anything passing by in the chat neither. So what I'm proposing is for us to have the 10-minute break now so that we can restart exactly in the hour for the last session for today. So talk to you guys again in 10 minutes. Thank you. We'll start the recording. Here we go. Thank you. Okay, so welcome for the third and last session of today's module, during which we will look at on how you understand basically the geography of the program or intervention that you are aiming at geo-enabling. So this is the beginning of step B in the overall geo-enabling framework implementation process, right? Once we have, once again, identified if and how geospatial data and technology can help addressing or resolve some of the priority or challenges that have been identified during the first step. This particular task is actually completed by doing three things. First of all, the understanding of the overall step B, sorry, is completed by doing three things, right? Not only understanding the geography, but also defining these, what we could call geo products to be generated to support the program or intervention, and as such address the challenges and our priorities that were identified during step A, and also identify, once again, the equipment, so hardware and software, as well as the technical expertise that is needed to generate this product. So we will cover the last two tasks, the second and the third one, during the third module of the training, so in 2 weeks from now. For today, let's look at what we mean by understanding the geography of a specific program or intervention and how we proceed to obtain such an understanding. So we achieve this understanding by identifying and documenting three things, or three components, if you wish. The first one is the understanding of the program or intervention strategy, right? What is being used as the strategy by the program or the intervention in order to reach its objectives. This is what will give the general context for the geography of the program or intervention. And it's really important because depending on how the program is being implemented, the program or the interventions are being implemented will have an impact of the second elements here, what we call the ecosystem, which is composed of the different geographic features that are central to the implementation of that project or intervention. So we need to have, in order to define this ecosystem, we need to have the list and also the definition of these different geographic features. We'll come back to this concept of geographic feature in the next slide. And the third component that we need to identify, which is also important, is the relationships that exist between these different geographic features. Relationships which are captured in what we refer to as hierarchies. I will also cover this concept in a minute. And the combination of the ecosystem, so the geographic features and the relationship, are actually serving as the starting point for the creation of what we refer to as a data model. And again, that's another concept I will cover in the coming slides. Before that, it's really important to mention here that all stakeholders involved in the implementation and the planning and implementation of the program or intervention that is to be geo-enabled should really be involved from the start of the process. Because not only to make sure that you don't forget anything when you look at defining this geography, but also it allows to make sure that there is a common understanding and an agreement on what this geography is. And as you will see, this is something that can be having an impact on the rest of the process. I'll show you some real examples in a moment. So let's start with the concept of geographic features and actually also geographic objects, because these two are related. So a geographic feature is, by definition, you have the definition here, is a naturally or artificially created feature on the surface of the Earth, right? While the geographic object is the computer or the electronic digital representation of such geographic feature in an information system, including a geographic information system. So for example, if I take the house where I'm currently sitting here in the Philippines, this is a real geographic feature, right? So this is something which is in the real world. So this is a geographic feature. Now, if I was to represent this house in a geographic information system, like by a point, for example, by a set of geographic coordinates, then this representation in the geographic information system will be the corresponding geographic object, right, which will represent this geographic feature in an electronic way. So we can differentiate different type of features depending on how they will actually be captured in the geographic information system as per the table you have here on the left. So we generally make the distinction between fixed features or features that are not moving, that can be represented by geographic coordinates, by a point like a house, but also a health facility or even a village, depending on the program or intervention you are looking at, are also represented by lines or polygons, right? A typical example for lines will be rivers from the hydrographic network or the transportation network. Lines could be more kind of these artificially created features like administrative or statistical or health divisions, right? The boundary of these areas. Then you have mobile features, right? Each of us is a mobile feature, but we have also vehicles, and you can even go to basically the point of considering other like vectors as also being mobile features. And the last category is what we call continuous features, which is more when you need to represent something like topography in a continuous manner, right? So you're going to have information covering your whole territory, your whole country, which are represented in a continuous way. So landscape, for example, topography, etc., are part of these continuous features. Now, the geography of each program or intervention is going to be composed of a set of these geographic features, right? That will then be represented as geographic object in the information system, including the geographic information system. So what you have here on the right is an example on how the vaccination distribution delivery system, I mean, all the different geographic features that are composing this delivery system, which was defined as part of the UNICEF document I mentioned earlier. Now, when you look at these geographic features, it's really important at the same time to ensure that there is an agreed upon definition that is associated with each of them. And this is not only to ensure that all the involved stakeholders have the same understanding of what they represent, what each of these geographic object or feature or object represent, but also because the final definition will have an impact on the next step of the geo-enablement process, as you will see in the forthcoming modules. You have here an example for one type of geographic features, which are health facilities. I've captured here a set of definitions coming from different, let's say, global or generic sources, as well as few country-specific sources. So what we can observe in these different definitions is, first of all, the presence of geography, right? We're talking about a place, we're talking about a building that has a certain location, right? But at the same time, a building, a place, or a location are different concepts, right? And so depending on the definition you use, some certain geographic feature will be or not considered as a health facility. The same applies for the other concept, the health-related concept that are included in these definitions, which will have also to be defined. What is meant by medicine? What is meant by healthcare? And this is going to be country-specific, right? So at the end of the day, it's really key to make sure that there is a clear definition of what we mean for each of these types of geographic features, because then again, this will impact on what goes into lists of these features, for example, as well as the information that should appear on the final products, including maps. Climate-related data. There's a question in the chat. Just 2 seconds. Thank you for that. One question: what about climate-related data about geographic information system? So you mean, I guess you mean the use of climate-related data in the information system. So climate data, depending on which one you're talking about, if we talk about like precipitation or things like temperature, right? So if this is not necessarily a geographic feature per se, right? This is capturing a specific climatic phenomena, but if we were willing to basically include them into a category here, I mean, there will be two types I will see. You could be having climatic stations, right? So climatic station as a geographic feature will be a fixed feature that is generally represented by a point. Now, what you generate out of these point data using specific spatial analysis, right? I'm not talking even about some imagery that can give you directly the information, but if you were to extrapolate the information between this climatic station, you will obtain continuous, basically, layers. So you will have a spatial distribution of your climatic variables, right, over all the area you are studying. So if ever we were to consider that as a feature, this will then end up here as a category. Yes. Thank you. Yes, climatic data. Again, climatic data is one of the parameters that goes into the type of data which might be needed in order to generate, right, the different products that can support program or intervention. Typical example would be vector-borne disease, where the climate data will have an impact and influence on the niche for the vector. Right? Thank you for the question. Coming back to the slides, so after having obtained the list of these geographic features, to be clear on what they are, to have a clear definition for each of them, the next information that needs to be captured to understand the geography of a program or an intervention is the relationship that exists between these different geographic features, right, to form the geography. So these relationships, are captured under the form of what we refer to as hierarchies, right? So which is really basically defining the relation that exists between these different objects. So there are different types of relations that can be captured. And you have some of them listed here on the left, right? Geographic features means, for example, is geography located within? So this is the type of relationship here that you will have in an administrative division hierarchy, for example, right, where a village is geographically located within a commune, which is within a district, within a province, within a country. They can also be specifically related to health, right? Like referral, for example. You have an example here of a hierarchy that is showing the relationship in terms of patient referral between different levels of the healthcare delivery system, right? And other ones like administrative or associative also. What's important is that by identifying and capturing these hierarchy, you are also defining specific information that needs to be attached to each of these geographic features to be able to recreate these hierarchies in the information system, right? If I take the first example here, an obvious example is that in your list of villages, hopefully a master list of villages coming, so for the authoritative list of villages, include information about all the upper level in the administrative structure, so that you can basically not only use this information to aggregate values that you might have collected from the lowest level, administrative level in the country, but use that also for other purposes. So again, that's an important step into understanding the geography of the program or the intervention. Now, once you have defined geographic features, they clearly defined, you have the relationship between them, you can use that as the starting point to develop what we call a data model, right? Which is meant to be captured in your information system. So this is the next step where you have three actually levels of data models that can be differentiated. The first one builds directly on the previous two slides, right? Which is your geographic features, how they relate to each other. So you basically combine all these hierarchies together, all these relationships that exist to develop what we call a conceptual data model. What's interesting to mention here is that by doing this combination, often can lead to identifying some relationships that were not identified earlier by just drawing hierarchies, right? So this is the first step of your data model. The second one, which is called the logical data model, consists in capturing the different data elements that needs to be associated to each geographic feature, right? Including those that will allow to recreate these relationships that we have been talking about. And then the third level is the physical data model, which capture, again, additional information to the one in the logical data model that really allow the physical implementation of the logical data model into the information system, right? The important point to remember here is the importance of starting really the process by identifying and defining these features, forming the geography of the program, of the intervention, or even of the entire health system. Okay, so you have some activity in the Q&A. Okay, so we have a question from Farhat. Healthcare referral hierarchy will be different as per the country system. Yes, definitely. And this is why these exercise of identifying the object, defining the hierarchy will be specific to each country and can even be very specific to each program within the country, right? So the way patients are referred for a particular intervention might not be the same as the way you will refer patient for another certain type of intervention. So that's why this exercise, if you really want to have the complete picture for your whole health system, you need to bring together all the programs, right, that are meant to be using geography, etc. So that you have the complete picture of all these, again, features, geographic features, their relation to them, and then lead to the development of a complete, comprehensive, conceptual data model, etc. And oh yeah, thank you. Two people is telling me two people are share example on how they have been using geospatial data and technologies in their respective countries. That's great. As mentioned, please don't hesitate to use the chat to share experience and examples. And I see someone is asking, is there also to share links? If you can put back at least the main links in the chat, that would be nice. Okay, so now geographic features, definition, hierarchies, conceptual data model, right? So this is the elements that will help having the understanding of this geography. So let's look at a few examples to illustrate why understanding this geography is so important and why this is basically really the first step to take place once it has been identified that geospatial data and our technologies can help addressing challenges or priorities faced by a program or an intervention. So the first example comes from Myanmar and is related to microplanning. The challenge there was that, like it's often the case in countries, that not all the target population was basically covered by routine immunization routine immunization microplans that were defined. So we took some time to really identify and also document the geographic features that were forming the immunization ecosystem in the country, right? So country-specific, what were these geographic features they are considering, how they relate to each other, and that led to this representation that you have here on the left. But I mean, if you look at these, I mean, visually, there should not be any missed population, right? Because the lowest building blocks in terms of areas is these API communities. And because they are contiguous, right, there is supposed not to be any gaps or overlap. So we kind of dig a little bit more into this concept of API communities to finally find out that there was a very different understanding of what these API communities were by different stakeholders, even within the expanded program on immunization between the central level and the township level. The understanding of what an API community was very different. And because of that, not all the type of communities were basically covered, which was the reason for some gaps into the obtaining the complete coverage of the definition of the population. So there was really a lack for a common definition and therefore understanding of the concept of API community. So the first action that was taken, and again, here, I mean, we have zero involvement of technology or electronic or whatever, is purely trying to understand the geography of the program or the intervention in a particular case. So the agreed upon definition we came up with was that an API community was a place where people live in community. Okay. Then that needed to identify what are the different types of API communities to make sure that we will be covering all of them. So that led to basically working with the API program to come up with a classification of API communities. And during that process, it became obvious that not only was there a need to have a definition for the different type of communities, but some of them were also having kind of a subtype, if you wish, because of the population presence that they were encountering, right? So some communities were always occupied all year long. Others were only occupied for short term and were temporary structures. Others were, and then disappear fully. Others were seasonal, right? So at a particular moment in time during the year, there was presence of a particular group of people in those communities. So by defining this type and also this population presence classification, then, and going back again now to the people in the field, it has been possible to identify some communities that were actually not yet covered by the vaccination campaign because they were not being considered as communities per se, right? So this is a first example, and this serves really as a strong foundation for the rest of the geo-enablement process of the EPI program in Myanmar. Another similar, more recent example, also related to microplanning, in Mozambique this time. In this case, the difficulty was that the microplanning form that was used in the field was combining different type of geographic features, again, communities, but also that is called povoados in Mozambique. And there was, again, really not a good clarity on what these two concepts meant. So there was a need, once again, to get a clear definition for both of them and also understand how they basically related to each other to make sure that the whole data collection process, right, the form was capturing information at the right level and was also covering, again, the whole population. And we spent really 2 months trying and discussing with different stakeholders at different levels within and even outside of the health sector, because the concept of povoados is not related to health, but it actually ended up that it was related to statistics, to try to understand how these features were, what they were first, and how they were related to each other. And at first, based on the discussions, the understanding was that the povoado was basically at a level below the community level, right? So a community was composed of several povoado, and actually the list we were getting from the district were tending to indicate this. But as we continued discussing, we were starting to have to make so many connections at different levels with other geographic features that something was off, right, basically. So again, more, and this is where we started to go and talk outside of the health sector to finally find out that it was the other way around. It was actually povoado, which was the upper level in the hierarchy. So which was these statistically defined entities. So they have no administrative role. There's no administrator in povoados in Mozambique. And so communities were part of these povoados. So we were completely reversed during 2 months, thinking that povoado was basically a lower level than community, while actually it appears to be an upper level. And the other thing that we've really finally find out is that the concept of community is not an official concept recognized administratively as an administrative entity in Mozambique. So there's basically no regulation in place to how you create a community. Everybody can create a community. So starting from there, it's very difficult to identify and to list them, because there's no governmental entity which has the official mandate to generate and maintain the list of communities. And the huge impact of these analyses and discovery is that at the end, we came to the conclusion to recommend even to the Ministry of Health, to the EPI program, that it might be better to actually define and manage the microplan at the level of what they call the concentration point, so the vaccination post, basically, because povoado had no administrative purpose, so again, very difficult to define. There was basically also no geospatial data in relation to that, and even more complicated to try to go down to the community level. So again, this is all done before even trying to collect data, to improve the quality of data, etc., in the country, right? So really importance of geography, I mean, understanding the geography, again, here in the immunization concept. One last example, which is not specific to any given country, but which is really having an important impact, and it has been several years that I've encountered that in different forums and also in different countries, is what I'm referring to as the difference in understanding and use of the concept of catchment area, right, by both the international community and also in-country stakeholders. And digging into this issue and trying to kind of clarifying this in a way that will be not only easy to understand, but facilitate really the implementation of programs and intervention in countries. What came out is that one of the first reasons of the issue was a mixing by people of two different concepts. The first one is the concept of health area, which corresponds to the division of the territory, of the entire territory, in contiguous areas, right? Each of them representing the area of responsibility of a given health facility or healthcare provider, right? So you have an example here of this type of areas. And the second concept was the concept of catchment area, which itself corresponds to the sum of places from where the population using a specific service are coming from, right? So while health areas are not overlapping, right, these are contiguous areas, catchment areas can lead to areas that are basically overlapping. So you can have people living next to each other, but actually going to different health facilities for various different reasons. So two different types of areas actually that people were referring to under the concept of catchment area, which was creating confusion very often. The other part of the problem, it was the lack of distinction made between actual, real, the real geographic extent of the health area or the catchment area, right, based on the reality, versus the geographic extent that is modeled, right? So sometimes you don't have the exact extent of your health area or your catchment area, and you use GIS-based approach to model these areas to as close as possible to the reality, right? When this is not available. And so by decomposing the two and coming up with, and you have an example, I mean, here this is an example of ways to kind of build contiguous areas that could potentially be close to the real health area, which we call proximity basins, right? And you have here an example of modeled catchment area, which is something that has been used for a long time before really the geographic information system and the availability and quality of geospatial data have been allowing to do better, which is this buffer approach, right, which you might have seen. So these are model catchment area. So by decomposing the two, separating health area from catchment area and from what is real, from what is modeled, then you come up with a classification that it's more easy to use and to apply, and therefore make sure you select the appropriate type of area you are looking at or planning to use in relation to your program or your intervention. So this classification, this terminology is something you find again in the Geo-enabling micro-planning handbook. And we hope, I mean, this is the kind of work that is happening at the global level, which hopefully is going to be helping for a more accurate understanding and therefore visualization and analysis of programs and interventions in countries, so the geographic aspect of that. So I hope these few examples help understanding really or demonstrating the importance of starting the whole process by understanding this geography of the program intervention of the entire health system. So let's now look at the process that allows to obtain such an understanding. So there is generally, you can do that using 3 exercises, which are listed here. We'll go in detail to each of them, but you start by identifying, of course, these geographic features specific to the program or intervention or the entire health system. You agree upon the definitions and you capture the relationship that exists between these geographic features. So exactly the 3 elements we have been looking at earlier to understand the geography organized in 3 steps, basically. These exercises are documented in the one of the Help GeoLab guidance document, which is mentioned here. And ideally, this exercise, thanks Isay for the link in the chat. And ideally, these exercises are conducted during a workshop attended by a key representative from the MOH, right? Which includes programs as well as a representative from the HIS unit. Right? And depending on the time at disposal, the exercise are all conducted during this workshop or can be also finalized through additional consultation with the concerned parties. So first exercise, just to show quickly how this is happening. So this has been conducted, for example, during the workshop organized with the support of the Global Fund at the end of last year with 11 French-speaking African countries. Did that in Dakar, in Senegal. So the first thing you do, you get the participants to basically use Post-it, one color per program, and one geographic feature by Post-it, right? So they write down which geographic feature they think about in relation to their program. Then the participant places the Post-it on the board according to their program. So you have here again one color, one program. So this is at the end, we're having three programs there, malaria, TB, HIV/AIDS, right? So you obtain at the end of this all the different geographic features identified by the participants as forming the geography of their respective program. And then what is happening is the person facilitating the exercise is grouping these Post-it according to the type of geographic features they are referring to. So as you can see, what ends up happening, and this was certainly administrative units, provinces, districts, etc., all the programs will be mentioning the same object, right? And this is really an interesting result of this exercise. It allows to demonstrate that most geographic features are actually in common to all programs, as you can see with the different colors of the Post-it placed here. And so you have here at the end of this exercise your ecosystem, basically here for across 3 different programs. You have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17 different geographic features that define the overall ecosystem across these the 3 programs. At the end of this, so you obtain a list, right, of geographic features that you can organize according to the classification, the type of features they belong to, the table I showed you earlier, right, between the fixed, mobile, continuous features. And this exercise, what's interesting here also is it allows generally to clarify some concept or some misunderstanding from the participants. Like, for example, making the difference between what is a feature, an object, and also a data element, because very often people are adding data elements to the board as part of the Post-it. So this is the first exercise, allows you to get this list of geographic features and to organize them according to their type. The second exercise, which is agreeing upon the definition, a definition for each of these features, identified during the first exercise, start by having all the participants provide their own definitions, right? If it's not already officially defined and captured in an official document, right? If there is an official definition, you will, of course, use this definition as the reference. So this generates a first set of definitions, some of which, for which there is a consensus, right? There's an agreement among all the participants, and some other definition, for example, where there might not be a full agreement at first. So when this is the case, that lead to additional round of discussions or even consultation until you reach the consensus across all the definition for each geographic feature. And this exercise definitely will require not only participants from within the health sector, but also from outside of the health sector, because there are geographic features that are important for health, which are not under the current mandate of the Ministry of Health, right? So you might have to involve the National Mapping Agency, the National Statistic Office, and potentially other line ministry like the Ministry of Education, for example, if schools are used as vaccination sites, for example. And then the third exercise is to define those hierarchies, right? So to take, again, the list of these geographic features that has been defined and ask participants to organize them. You can use post-it again, where you will have one geographic feature per post-it. And on a whiteboard, they will be placing these different post-it and building a relationship between them until there is again a consensus among themselves and having captured all the hierarchies for the program and our interventions that are concerned. Then you will at the end capture each hierarchy. You will take a picture at first, but then you will convert that in an electronic format so that you have something in a way that can be reused for the rest of the process. What's important to keep in mind, and you have here an example of an exercise we conducted with Cambodia a few years ago, is that a given geographic feature can be part of several different hierarchies, right? Here you have the example of the health post, which is appearing in 1, 2, 3, 4 different hierarchies here that was defined in collaboration with the Ministry of Health, which is the reason why it's interesting to do this next step in the exercise and to combine them into a conceptual data model, right? Because in the conceptual data model, you will have each geographic object represented only once with all the relationship with the other ones. And that's what helps sometimes to identify some relationship that were forgotten at some point in time. Okay, so all of this is leading us to the homework that I would like for you to contribute between now and the next module, which will consist in a collective identification. So we're going to be virtually recreating the first exercise I was mentioning earlier with the post-it, right? Trying to identify, and everybody can contribute here, MOH and partners, Asia Pacific and beyond, to kind of try to identify which geographic features are specific to each program that are either represented here by colleagues from the Ministry of Health or supported if you are a partner like UNICEF or WHO or CHAI or any other NGO. If you are on board of the call, capture the geography you are familiar with in relation to the program you're supporting. So the deadline for this homework is July 12th, at the end of next week, to be able to have the time to analyze this. So I will invite you to basically connect to this whiteboard, virtual whiteboard that we're going to be using, which is using a free online application called Canva. You have the link in the chat. Thank you, Ise. So once you connected there, this is what you will reach. We'll wait a little bit to have at least most of you being connected. Okay. We're gonna have a complete Zoom. Okay, 15. Let's wait a little bit more. Participants to come on board. Here we go. Okay. 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 So what you have here on the left, so we have considered a set of programs. Let me zoom a little bit. So you can zoom either by using the bar here on the lower right side of the screen, or you can basically point the mouse at the place where you want to zoom, hold the control button, and turn the wheel on your mouse, right? And then if you want to move left and right, you have a bar, right, that allows you to do that. Same thing for up and down here, okay? So what we have here on the left, we have a set of programs, right, which are the programs. Some people are already drawing things that doesn't need to be drawn. That's okay. You put to delete, you just select and you click the delete button, right? It's a very intuitive system. Just try not to delete the original boxes. So we have 1, 2, 3, 4, 5, 6 program or unit within the MOH. And then if you are from another or you're supporting another program, you can use the other category. So what I need you to do is to select one post-it corresponding to the program you represent or you support, for example, here immunization. And then you will move this post-it in the corresponding box for that program, right? So here I took a post-it for immunization. I put it here. You can then zoom on this particular post-it. And by double-clicking on it, you will be able to write on the post-it. And what I would like you to do is to basically first write the name of the geographic object, right, that you are considering. So for example, for immunization, here village is very important. The second thing is what type of object we are referring to. Is it fixed? Is it mobile? Or is it continuous? So here it's fixed. And the third information I would like you to write is the country for which you are entering the information. So for example, here, Thailand, right? And you can do as many post-it as you want. So one post-it per geographic feature, right? So you can use them from the side here. If you need more post-it, you just basically select your post-it, Control-C, Control-V, and you will have a copy, right? So that allows you to have an indefinite number of post-it to be added on the board, okay? I think that's it. Yeah, if there is any questions, if it's not clear, don't hesitate to write it in the chat. What you have on the next slide in the presentation that will be shared with you is the description of the step I just mentioned here, right? And you have again until the 12th to basically complete this exercise. And next week we will look at the board and we will also basically I will group these different geographic features by type. So we will see what come out of this global exercise. Again, quickly to remind you about the questionnaire, right? For those that joined after the beginning of the seminar, of the training module today, sorry. Thanks in advance for that. Again, also deadline on July 12th. Let me see if I have some question. Okay, one question in relation to the homework. Should we work on all or optional to select some of mentioned program? So you can, if it depends if you are involved in one or more programs, right? I will say just do the exercise in relation to, again, the program you either represent, if you are from the Ministry of Health. So if you are from EPI, just provide objects for immunization. If you are from the malaria control program, the object, also the features for malaria. If you are a partner supporting the Ministry of Health, if you are supporting multiple programs, you can actually mention across multiple programs. If you are supporting only one program, just do that in the corresponding program. Okay. Any other questions? No, we have some question in the Google form. I will answer those questions separately because that requires a little bit more information. Just one thing. Yes, someone is asking, is making mention about the some grants, some support that are accessible in relation to geospatial technologies. We will cover that during the module that is dealing with technologies, which I think is module 4, if I'm not wrong. So we will definitely do that. And yes, there is a grant that allows countries to apply. So I'll share already this information to the person who asked about this, and we will also cover this during module 4. And the other question also, I will answer that by email. That's a long question, and we will not be able to do that now. Okay, last thing I need to do is to show you the schedule for the third module and the agenda. So the next module is in 2 weeks, 17th of July, same time, same place, in a way. In this module, we will be looking at the products, the definition of the products, right? The GIS-based geo-related product. And we look at their purpose, audience, content, and format. How do you basically define all of these through the geo-enablement? And we will talk also about the equipment and technical expertise needed to generate these products. We will then talk about how to assess the current level of geo-enablement across the 9 elements of the HRS geo-enabling framework, which will be the entry point to show the result for the remaining questions from the HRS geo-enablement level assessment questionnaire. So once again, the more answers we have, the more interesting this session is going to be. I just have to thank you for your participation today. I'm looking forward to seeing you again in 2 weeks from now. Ridvan, I don't know if you want to say something to close today's session.
No, just thank you, everyone. So I will hopefully we meet again next week, and then and do the homework. Good luck.
Thank you, everybody. Take care.
Don't
hesitate to use the Google form if you think about something by the time of the next module. Bye-bye. Thank you.
Bye.
Thank you. Bye-bye.